Science 30, welcome to our video on blood pressure and the contraction of the heart, which we refer to as systolic and diastolic pressure. The goal today is to talk about how your heart rhythmically contracts and how that leads to these readings called systolic and diastolic readings. And again, review back to that pulmonary and systemic pathway. We're going to review and connect to the different vessels that we've talked about, such as venules, arteries, capillaries, veins, and arterioles, as well as we're going to look at how do you measure your heart rate. The goal for you today is to make sure that you understand the difference and remember the difference between a pulmonary and systemic pathway, as well as remember the differences between all the vessels we've talked about. We also want to talk about how do we remember which vessels do what, so explain which vessels take blood away and which ones bring it to. Can you measure heart rate? Can you measure blood pressure? And we're going to look at how factors affect all of those things. So let's get started on systolic and diastolic pressure. So here's a picture of a heart contracting. And what you're going to notice up here is you can't see inside, but this little lovely flap that sits on top here is known as your atria. And as we learned, atria brings blood into the heart and it passes from the atria into the ventricle. Blood pressure is changes in corresponding to the beating of the heart. So when these larger parts of our heart, our ventricles, contract, okay, blood is forced out of the pulmonary artery, because remember, arteries take blood away, and it's put into the pulmonary arteries or the aorta, and you will have a pressure increase as those ventricles contract. Now, systolic pressure is just a nice fancy way for saying maximum pressure. So as our ventricles contract, we call this systolic pressure. So you need to know systolic is when ventricles are contracting and moving blood out of the heart. Diastolic, as you can see in the picture here, is when we have really low pressure. This is when the ventricles are not contracting. They're kind of in between a contraction. And we call this diastolic or low pressure, which just means filling. So diastole just means our ventricles are filling up. So let's compare systolic to diastolic in regards to our heart contracting, the blood pressure, and where blood is moving. So in systolic pressure, we would say our heart is contracted, specifically the ventricles. It is moving blood into the aorta or into the pulmonary arteries. In diastolic, our ventricles are relaxed. They're not actually contracting. They're nice and relaxed in between contractions, and they're just filling up. When you have a contraction, your blood pressure raises because remember, our arteries stretch and take all of that blood, so that push of all that blood into your arteries is going to cause high blood pressure. And when you are not contracting your heart and not pushing blood into those arteries, you're going to have low blood pressure. Now, in the movement of blood, if it's in the heart, it's going to move out of the heart and into the vessels. We're pumping blood out of the heart. And here, blood moves out of the blood vessels, such as veins, because remember, we're filling the heart. So veins bring blood towards the heart. So blood moves out of our veins, specifically the superior inferior vena cava, as well as our pulmonary veins. And it's going to move into the heart, into the atria, and fill into the ventricles. So we are going to get an opportunity to try this out. You don't have to write anything down for this. I just wanted to show you this is a blood pressure cuff. The fancy name for it is sphygmomanometer, and it measures a healthy person's blood pressure. Now we say an average healthy young person is 120 over 80. I would say that's even a little too high. I would say I am 120 over 80 most likely. So what we're going to do is we're going to look at this lovely chart right here, and we're going to compare our heart rate, which is how fast our heart beats, which we can measure on our smartwatches or with our pulse, to blood pressure or the movement of blood through our body. You'll notice in your book you have heart rate, and then below it says heartbeat. That should say blood pressure, so just cross it out, and then we're just going to put this chart into our notes. So for your heart rate is what is the beating of your heart. So every time your heart opens and closes valves. Every time you open and close a valve, you're going to hear your heartbeat. So a valve opens and slams shuts, lub, opens and shuts, dub. So every time those valves open and close, that's when you're going to hear your heartbeat. Now, as your heart beats faster or your heart rate goes up, we measure that in beats per minute. Now, this value can range from 60 to 100. It can be higher, it can even be lower depending on your lifestyle. And we usually look at it as one value. I have 72 beats per minute, 86 beats per minute. Okay, it's one value, and you can feel how fast your heart is beating. If you hold your hand over your chest, you can feel that bump, 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 bump. If you were listening to it on a stethoscope, you would hear it bump, 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 bump. And those bumping sounds, that sound you hear of almost like a drum beat, is those valves opening and closing. Now, in contrast to blood pressure, even though your heart is helping with blood pressure, we're actually talking about the pressure of it in the circulatory system. So inside the pulmonary arteries and the arteries of your body, inside the veins and the venules of your bodies, right? So it's the blood circulating through your pulmonary system and your systemic system. We measure this in millimeters per mercury. And like I said earlier, we might see a value of 120 over 80, 120 being your systolic pressure, your highest pressure, and 80 being your lowest pressure. Now, we talk about it being two values because we measure our blood pressure in the movement of blood from our ventricles, systolic, to the relaxing of our heart and the filling of our heart in diastolic. So if we look at just a simplified drawing of the heart, you have not seen this yet, but we'll talk about it. What you have to understand is that every time we're talking about blood pressure, we're talking about the movements between the pulmonary and the systemic system. So if I go back, we're looking at what happens after we fill our atria, and then it fills our ventricles, so that's diastolic, and then gets pushed out of our ventricles to our lungs in our body. If it's going to our lungs, that's our pulmonary system being taken by any sort of artery. And on this side, it's our systemic system being taken by our aorta to our body. As it comes back to our heart from our body to the right side, we're going to do that through veins. And as it comes back from our lungs to our body, or to our heart, sorry, it's going to be done through pulmonary veins. So that is the difference between a heart rate and blood pressure. And hopefully you got a little bit of understanding of blood pressure. If you have any questions, please let me know.